So I'm on my way to work to be a PCA, personal caregiver. This is a really terrible time. There are not enough people to do the CNA work, so they let us PCA people help and do it. I love it. I mean, I don't mind, the dirty, parts of it, because you're helping somebody, and a lot of women feel the same way. They love their job, but sometimes it gets too difficult because it's hard to find people that love that job. And you can't really go into it for the money because it doesn't make that much money. I know my disability check and my part-time work is about the same as if I were to do it full-time. So, why would I do that? But the one thing that I think we could definitely change and get better is we have a lot of no-shows, people that just don't show up for work. And they don't get fired. I mean, they just don't show up. And then, the staff, the nurses, the RNs or the LPNs, they'll say, well, we're going to have to give you some more patients. You're going to have up to 25 patients instead of 10 or 15. And so the nursing home doesn't lose any money on that. They may not even want us to be fully staffed because they make more money that way. And I know our charting is all about getting money from the insurance companies. It's not about the patient. It's not about me. It's about getting the facility money. And that's why we have to chart. But if we paid our CNAs that show up a salary that's contingent on the amount of patients that they have to have, like for me, I should probably get less because I'm not as good. I probably shouldn't take care of more than eight or 10. I hope they sure as hell don't give me 20. But the ones that are really good at it, proficient, and have done it for a long time, if you're going to pile extra patients onto their caseload because somebody doesn't show up, then they should get paid for that. Not overtime, but load time. Like, you have to do 20 patients. It's impossible to brush their teeth. I mean, you just don't have the time because you have to go through and make sure their beds aren't dirty and their depends is dry and clean and stuff like that. And you have a time where you've got to feed them. Some of them are feeders, and that takes a while. So, you pile 20 on a person, it's not going to be as good a care. But that nurse aide is going to be busting her buns to try to make it happen because she probably cares about the patients. I know I do. So I wouldn't let the nursing homes get away with us being short-staffed, and they collect the money. Yeah, they're not paying a salary, so they don't have to pay, and they're just doubling the caseload on a person who may not know how to speak out in government and say, hey, this is not right, it's not ethical, because the patients are not getting as good a care. And, it's a heavy lifting job. It can be, definitely sometimes you have to have two people if a patient is overweight. I've seen a lot of stuff that I don't want to tell you about. All right, thank you.